Someone who just wants to when you have neck pain? Well, hey, my name is Dr. Becca and I'm the physical therapist that is going to explain what mechanical or non-specific neck pain is, what are the best treatment methods according to the research, then we'll go through a quick demonstration of proper posture and positioning, and then finally get to a generalized exercise program. So please skip ahead to, if you'd like, to different sections, but you're going to benefit the most by watching the entire video. So stay tuned. First off, mechanical or non-specific neck pain means that you could have aching, sharp, constant, intermittent pain that can present itself around the neck area to the shoulders and upper back. Very descriptive, right? That's because the source of the pain could ideally arise from the spine and any of its supporting structures such as the cervical facet joints, ligaments, muscles, fascia, and even discogenic pain without radiating symptoms down the arm. Other common symptoms are stiffness, tightness or tension of muscles, dull pain to the area, difficulty sleeping, reduced range of motion at the cervical spine, tenderness, a gradual onset, and some activities or positions can exacerbate it. Now, cervical radiculopathy means you have more radiating numbness or burning and involves injury to the peripheral nervous system. However, we are not discussing this category in our video today, nor any other sources of pain that could be the following. So what is really happening at the neck then? Usually mechanical neck pain is diagnosed by excluding other diagnoses first, because of the nature of this neck pain is more intermittent or activity dependent. So if we take a look at different muscle groups at the cervical spine, we can see that a lot of these muscles are attached at the cervical and thoracic spine and the shoulder blade. Because of these shared muscle attachments, how we utilize the shoulder blade muscles and its dependence on shoulder activity can influence what types of balanced or unbalanced forces put pressure on the spine. So there are 6 primary movements of the shoulder blade, or what we medically call the scapular-thoracic joint movements. And these are scapular upward rotation, scapular downward rotation, scapular elevation, scapular depression, scapular retraction, and scapular protraction. The same can also be said for how we position our upper body and head for longer durations of time, as this could either abnormally elongate or shorten cervical scapular thoracic muscles. Now, the research has investigated this, showing that cervical scapular thoracic and upper extremity strengthening exercises above any other treatment method demonstrates the strongest effects of moderate to large pain reduction immediately after treatment, and with long-lasting effects if done consistently. Again, the theory behind mechanical neck pain is because of 2 possible reasons. Reason number 1 could be due to poor posture control over longer durations of time, which produces abnormal positioning to the cervical thoracic spine and shoulder complex. Reason number 2 could be if there's impaired scapular thoracic muscle activity, then this could play a critical role in how load is transferred between the shoulder blade and the spine. So the most responsible muscle groups for this reason are your upper, middle, and lower trapezius muscles, rhomboids major and minor, serratus anterior, levator scapulae, and pectoralis minor. So I can make myself an example of this when I overdid too much rock climbing over a period of time and with little rest. So now I have to deal with intermittent neck pain due to an injured latissimus dorsi combined with some weaker mid-scapular muscles on my right side. So therefore, if I want to continue rock climbing and maintain balanced loading at my scapular thoracic joint with more shoulder activities such as rock climbing, then there are some exercises I must return to periodically in order to stay symptom-free at my neck. Now, we're only going to be looking at posture in a sitting position because of the highest prevalence of neck pain is, of course, when we're sitting. So looking from the bottom up, feet should be ideally flat on the floor with knees at 90-degree angles. The lower spine should have a slight concavity, and your chair or other supportive cushioning can assist with this. Elbows should be at about 90-degree angles. Your chest should stay high in order to elongate your spine further. The middle of your ear should try to be bisecting the middle of your shoulder. And the top 1/3 of your computer screen should be at the height of your eye level. The top of your computer screen should not be at the same height of your eye level, and this is a big misunderstanding. So let's finally move into the exercise for mechanical or non-specific neck pain. So as you can see, there are many different types of tissues that could be injured to cause mechanical neck pain symptoms, So I've created this exercise program to be more generalized to encompass all of these scapulothoracic muscle groups. So these exercises begin with more focus on returning normal cervical range of motion with different stretches, and then we'll move into the more important shoulder and scapulothoracic strengthening exercises to help reduce your pain. So at this time, I'll go ahead and say, please boop the like button if you thought this video has been helpful to you so far, and please comment below your thoughts. I'd love to hear from you. And without further ado, let's fix this neck. All right, so the first one we have here, I'm using my hands to gently push back into cervical retraction, and then I'm holding that position just for a second or two. You really want to get that double chin going in this. Okay, next one, we're going to be doing cervical extension, so I'm using a small towel, just fold it up a little bit, and then going behind your neck, your hands are gently pulling forward as you're extending back, and you can go further and further on each repetition. So before I do extend back, I'm retracting my head first in order to prepare myself for extension. And then our next one are called snags. This is helping for cervical rotation, going to our end range. Your top hand, which is my left, is going to be pulling towards my left. And the towel should be wrapping around your cheek or your mandible for comfort. And just a caveat, make sure you have good posture during all of these. You don't want to be slumped forward. So the same thing, I'm pulling with my right hand now, going towards my right. Okay, now we're getting into our strengthening exercises. The first one is a bent over row with weight. So find a weight that's comfortable but challenging for you. You want to make sure you're maintaining good posture as you're bent over and you're squeezing those shoulder blades together as you're pulling up. So another method you can use if you have a TheraBand, or in this case I have tubed TheraBands. Same thing, you're just stepping on the TheraBand, bent over a little bit and pulling both shoulder blades together. I just like this method because I'm able to do both sides at once. And then we have, so I'm using a stool. This is not necessary for you. You can use a bed or a couch. This is just for filming convenience. So I'm doing my prone flies. I have no weight right here, but I'm pulling my shoulder blades together during my prone flies. And if you want to start adding weight, hey, a pumpkin puree can is just fine. It's the season before you make that pumpkin pie. And if you want to go up a little bit more weight, you can use a 2-liter water bottle. This is about 5 pounds. So same thing, you want this to be challenging enough for you, so hey, find any object around your home, it could work just fine. And if you don't like that method of laying down, you can also use tubed TheraBand for pull-aparts. So same movement coming out of your mid-back, you're squeezing your shoulder blades together. Shoulders are elevated to about 90 degrees. Okay, now we're getting to our standing shoulder abduction exercises. You can use either tubed TheraBand for this. I go a little bit past 90 degrees and then come back down. If you don't have the tubed TheraBand, that's totally fine. You can use, again, another object or water bottle around the home. You want to make sure the weight is challenging, but you're not going to be compensating with other body parts. Okay, this one is working on serratus anterior. We're on all fours, and my elbows are locked as my shoulder blades are going up and down. So the point of exertion is where I'm trying to dome my mid-back here. A level up is where I'm into a full plank. I go down and then push up, doming my back. My head is staying in line and it's not moving. And if you want to go further from this, you can go down on your elbows into a plank position. This is a more advanced version. And still doming that mid-back. And even further advanced, doing the one-armed plank. So I do these just to make sure I'm isolating each side. And our last one is going into Superman's. Easier version is where your elbows are bent, and then if you want to extend out, you're trying to lift up, and we're getting those lower traps. So those are all the exercises today. I hope you enjoyed, and I hope this has fixed your neck pain. See you next time.